Jagger.
Thanks, Deputy Speaker. Well, many people in my community are rightly concerned about access to healthcare, particularly when it comes to being able to see a GP at the moment. And I want to thank all the locals in my community who've taken the time to contact me and share their concern and their experiences about how difficult it is to see a GP and, in particular, to access a bulk billing service. I want to thank the hardworking GPs who have also come to see me to explain how they feel stretched and burnt out and not sure how long they can continue for. I know that having timely access to healthcare has real impacts on people's health and life. A deferred trip to a GP because of unavailability or cost can mean serious consequences down the track. And of course, it's not just individuals who suffer because of this. We all suffer when our community is unhealthy, when health problems are left to crisis point and our busy hospitals are stretched even further. Deputy Speaker, we didn't get to this point by accident. It has been 9 long years of cuts and neglect to Medicare under the previous Liberal National governments, including, most significantly, a 6-year freeze on the Medicare rebate. And the result of this is that it is harder than ever to see a doctor, particularly a GP. It's never been more expensive to see a doctor. For the first time in the 40-year history of Medicare, the average gap fee for a standard GP consult is now more than the Medicare rebate itself. This cannot go on. And my community has sent me here with a very clear message, which I'm taking to the Health Minister, which I'm raising here, that we must invest in our healthcare. We must make it easier to get access to GPs and good healthcare in our communities. And I know that unlike previous Liberal National governments, these calls are not falling on deaf ears. Labor is the party of Medicare. We created Medicare and we will always protect it. Our government has no higher priority than strengthening Medicare and rebuilding general practice to ensure that Australians get the care they need when and where they need it. After 9 long years of cuts and neglect to Medicare, particularly that 6-year Medicare rebate freeze, we know that this is not going to be a quick solution. We know it's not going to be easy, but we are committed to making it work. We are committed to fixing Medicare. And I want to reassure residents in my community, whether you're in Eltham, whether you're in Greensborough, in Heidelberg, right through my electorate, that we know that you want to be able to see a GP when and where you need it. You want it to be affordable. You don't want to be left in a position where you have to go to an emergency room. So the investments our government is making, the $750 million to deliver the highest priority investments in primary care, the investments we will make in the budget in May, these are important. They are all part of our efforts to strengthen, to fix Medicare after it being neglected for too long under the Liberal Nationals.